Allegations of abuse, overmedication, and overall lack of care. A new WRAL and North Carolina Health News investigation reveals what inspectors learned about a company that runs 3 mental health facilities in our state.
WRAL Investigates. Sarah Kruger looks into what's happening at the places meant to help the most vulnerable.
7 children, all patients at Holly Hill Hospital in Raleigh, escaped from the facility over a 3-day period in March. Jason Clark's daughter tried to be one of them.
I think she wanted to leave because anytime she's been there, it's been involuntary, and she really hasn't had the help that she needs.
Clark's concerns mirror those about another facility in our state where a lot of people from the Triangle are sent for treatment. That's Brynn Marr Psychiatric Hospital in Jacksonville, owned by the same parent company, Universal Health Services.
Would you feel comfortable sending one of your loved ones to Brynn Marr?
Absolutely not. I would never.
Victoria, who worked as a social worker at Brynn Marr, agreed to talk to us if we didn't use her full name.
It's ineffective and it's dangerous.
Through a records request, WRAL Investigates found Holly Hill was cited by health regulators in 2021 due in part to patients escaping. It was put in immediate jeopardy of losing federal reimbursement, the most severe citation a hospital can get. Brynn Marr was also under that status last year for the same reason. Those we interviewed say the culture focuses on medication instead of treatment.
It's more been about medicating her to a point of not thinking about the issues rather than discussing the issues.
State records even show an anonymous Brynn Marr doctor interviewed by regulators admitted to the reliance on drugs. The doctor's comments were supported by 13 former staff members interviewed by NC Health News. 3 of them also claimed that patients ended up in the ER because they were over-medicated. Brynn Marr CEO Cynthia Wan confirmed that there were a few cases when hospital staff sent patients to the emergency department out of an abundance of caution due to adverse drug reactions, but she strongly denied other allegations. She wrote, "We do not think extrapolating conclusions based on the out-of-context statements of a handful of former employees is fair to the thousands of employees or patients who have received good care without incident."
It is basically a juvenile detention center.
Michelle Van Story says her 17-year-old had another concern during his stay at Brynn Marr: physical violence.
It is a always watching your back situation with the other patients.
Concerns validated by the doctor interviewed by the state, who said staff was afraid of patients and not properly trained, so they didn't try to de-escalate aggressive behavior. Police records obtained by North Carolina Health News show from January 2019 to September 2023, officers responded to 116 calls for assaults at Brynn Marr and 129 times for sexual assaults and rape allegations.
If you had to try to pinpoint what is at the root of the issue at Brynn Marr, what is it?
It's not really about the treatment. I think it's about making money.
Sarah Kruger, WRAL News, Raleigh.